Dr. Andrews, thanks for your time. We appreciate it. We're going to talk about the flu, it being that time of year or pretty close. With the subject of preparing, with respect to the subject for preparing for flu season, when is the best time to get vaccinated for the flu?
Well, as soon as flu vaccine is available, which it's been available since end of August in most areas. So the CDC, the Centers for Disease Control, is recommending that everybody get vaccine as soon as it's available. So now.
Okay. And who should go do that now? Who should get vaccinated?
That's another big push, is that we're recommending that everybody over age 6 months get vaccination. Last year, about 40% or so of the U.S. population was vaccinated. We're trying to see if we can get about 2/3 of the population this year. Last year, about half of children, about half of pregnant women, and we should do better than that this year. So really everybody, although the groups that should be most focused on would be pregnant women, those with chronic illnesses, especially heart disease and lung disease, people that are healthcare workers, that live in a nursing home. Those are the main people to focus on, although really everybody.
Well, one of the things that you hear is an objection to getting vaccinated for the flu. One of the things that people will say, I don't want to get, state as a reason for not doing it is, well, I'm afraid I'll get the flu from getting the vaccine. Fact or fiction? Can you get the flu from getting the vaccine?
Categorically no.
Okay.
It's absolutely not happening. The majority of the vaccines are killed virus. They're inactivated virus, and the vaccination, the immunization component is not the infectious part of the virus. So you cannot get it. There is one vaccine that's a live virus, but it's attenuated, meaning that it's weakened to the point where it cannot cause infection either. So categorically, you cannot get the flu from a vaccine.
Well, then why do some people say, they persist in saying, well, the flu vaccine gave me the flu?
Some of them have the flu. That's the surprising thing. The flu vaccine takes a couple of weeks to work on the immune system. And when the flu is prevalent in the population, it is not uncommon to be exposed to the flu before your vaccination takes effect. So there are some people that get exposed the few days before their vaccine, or even up to a couple of weeks after their vaccine, and they actually do contract the flu because they were exposed to it before their vaccine takes effect. In addition to that, there's all kinds of viruses and other illnesses that are seasonally in the population at the same time, and it's not uncommon to get one of those and say, well, it was the vaccine that gave it to me.
We always say, flu vaccine, you say flu shot. That has been the way that the vaccine has been delivered, but there's other ways to take the vaccine now, including something new called intradermal vaccine. Explain all of that to us.
Very new. This is the first year for the intradermal, which is a very, very tiny needle that used to deposit the antigen, the flu antigen, under the skin rather than deep into the muscle. The effect of stimulating the immune system is exactly the same, so it works just as well as the flu shot that goes in the muscle. In addition, there's three other ways besides the intradermal. There's the traditional flu shot that goes into the muscle. There's a high-dose flu shot that's for elderly people. And then there's also the live vaccine, which is the flu spray. It goes in the nose. And that's for only those age 5 to 49.
Is one preferable to another?
They all do the same thing. They all are equally effective.
How do you know if you really have the flu or just a garden variety rhinovirus cold?
Again, a lot of the viral illnesses are in the population at the same time. Flu and colds are transmitted roughly the same way. They're in the same populations, and so they're very hard to separate. But there are some good guidelines that people can know. Fever is not as common in a cold as it is with flu. It's virtually universal with the flu. With colds, it's not that common. Cough is common to both. Sore throats are common to a cold, but not the flu. Headaches are common to the flu, but not a cold. So there are some ways to distinguish. The easy way is that when flu is in the population, when it's prevalent, in other words, in the middle of an epidemic or a flu season, the presence of a cough and fever of 100 degrees or higher is about 80% predictive of positive flu.
Okay. Now you've got the flu. Didn't want the flu, but now you got the flu. So are there medications available to help you lessen the severity of your flu symptoms?
Yeah, there are. The two prescription medicines, the two types of prescription agents, work generally the same way. They reduce the viral replication or the multiplication of viruses in the body once you become infected. And it's very effective doing that. They work in a little bit different ways, and they only work very well if they're taken within the first day or two. So if they are taken the first couple of days, they lessen the severity, and they also shorten the length of infection. There are many over-the-counter things as well.
Okay. Apart from bed rest, drinking fluids, are there other comfort measures you can take once you have the flu?
Those are the best. Flu makes one want to just crawl under the bed and not come out, and that's not a bad idea. Rest is very important. And fluids, getting plenty of hydration is also very critical. Probably one of the most disturbing problems with the flu is the muscle aches and the achiness and the fever, and those can be pretty well managed with simple over-the-counter ibuprofen or naproxen, some of the over-the-counter non-steroidal medicines, as well as acetaminophen. Those work as fever reducers as well as helping the muscle aches.
When is it okay to just ride the flu out versus when do you need to go see a doctor?
Good question. If it lasts longer, typically the flu will last 4, 7, 10 days. If it lasts longer, or if complications develop, the most common probably is pneumonia. The flu virus typically causes just a standard infection, but flu pneumonia can be pretty severe. That mostly occurs on people that in persons that have impaired immune systems, the elderly. Those people can get very severe complications, typically pneumonia, and they should definitely be seen by a physician.
And how do you recognize when it's time to make the call? When do you know to call the doctor? Is there a tripping point?
Fever that won't stay down, difficulty breathing, productive cough, those are more signs of a pneumonia rather than typical flu. A dry cough is more consistent with the flu. Productive cough is more characteristic of a pneumonia, and that's kind of a warning sign that it's progressing to a pneumonia.
Very well. Doctor, thanks for your time.
My pleasure.